Welcome to our educational series on prostate cancer here at the International Robotic Institute for Prostate Cancer in Miami, Florida. I'm Dr. Sanjay Razdan, and I'm the Director and Chief Urologist, Urology Cancer Surgery at the Institute. Robotic radical prostatectomy is the surgical standard of care treatment for men with localized prostate cancer. The precision of the robotic approach has allowed surgeons to not just focus on cancer cure, but also two other equally vital metrics after surgery, that of urinary continence and erectile function. These quality of life endpoints, along with cancer control, represent the trifecta of robotic radical prostatectomy. The rates of urinary incontinence after robotic prostatectomy can be as high as 60 to 80% immediately after surgery, with recovery in the ensuing year. At 12 months, most men recover urinary continence with rates around 92%. Urinary continence is influenced by baseline urinary control, but also refined surgical technique with preservation of the external urethral sphincter being absolutely vital. Here at the International Robotic Institute for Prostate Cancer, I have pioneered a technique of Maximal Urethral Length Preservation, or MULP, that has resulted in almost immediate return of urinary continence after radical prostatectomy in the majority of patients. MULP involves not just preservation of the external urethral sphincter, but also around 1 to 2 centimeters of intraprostatic urethral length, better allowing for a tension-free urethrovesical anastomosis and immediate continence with zero pad or liners at an average of 3 weeks after surgery. We also showed that MULP preserves penile length after robotic prostatectomy. Erectile function recovery is historically much worse after robotic prostatectomy, with only a third of men achieving weak erections at 1 month after surgery and only half at 1 year. Like urinary incontinence, erectile function post-op is influenced by preoperative erections. Also, baseline hypertension, diabetes mellitus, and hypercholesterolemia can affect erections after surgery. Now, while the patient contributes partly to their erection recovery after robotic prostatectomy, the surgeon plays a vital role by ensuring preservation of the nerves responsible for erections during surgery. These nerves run in a neurovascular bundle around the prostate and can be easily injured with poor tissue handling. I have pioneered the use of clipless nerve-sparing as well as human amniotic membrane grafting to accelerate return of erections after surgery. By avoiding the use of clips, I'm better able to hug the contour of the prostate and preserve all the nerves laterally. Additionally, using the amniotic membrane graft creates an anti-inflammatory microenvironment that allows for rapid nerve healing. In our landmark initial series, most men were able to achieve an erection sufficient for penetrative intercourse at an average of 1 month after surgery. If you have been diagnosed with prostate cancer and are considering surgery as an option, it is important to understand the risks involved. Trifecta achievement takes time and expert surgical technique. Here at the International Robotic Institute of Prostate Cancer, I have spent decades perfecting the perfect prostatectomy to ensure exemplary outcomes in my patients. Don't be cavalier about your health and make the right choice. Thank you.